I would like to invite on the stage and directly to the podium Professor Enrico Occhipinti, Chief Research Unit in Ergonomics in Posture and Movements. You can stay at your podium. And his discussant, of course, in substitution, and he will present himself, Alvarez Casado Enrique, industrial engineer. Please come to the stage then. Okay? I would like to remind everyone, of course, time is our enemy. Okay?
Okay. But I have not the pointer.
Okay.
Hello, here's the phone. Good afternoon, ladies and gentlemen. I'm really honored to give you this presentation on biomechanical overload and prevention of musculoskeletal disorder. And I want to thank the organizer for this wonderful opportunity. But I want also to thank Daniela Colombini that prepared with me this presentation, both the contents and the format. And first of all, I want to remember our maestro, Antonio Grieco, that to me was a master of science, but also a master of life. And coming to the topic, biomechanical overload stays for a condition where a load that can be considered excessive is applied to parts of the locomotor system. And biomechanical overload is typical in many working activities implying manual handling, repetitive movements, awkward postures, and similar. And those conditions, for instance, manual lift is encountered in many jobs, especially in agriculture, in construction, in fishing, and others. And biomechanical overload of the upper limbs is encountered not only in typical manufacturing tasks, but also outside the manufacturing context, again, in construction, agriculture, fishing, and craftwork. And if you consider the global workforce, the official global workforce, by Eurostat, we know that there are more than 3 billions, about 3 billions and a half of workers in the world, and 25% of them, more than 25% of them are involved in agriculture. About 5–10% of them are involved in construction. 13% of them are involved in manufacturing. But also in the grid sector, of the service sector, there are many sectors or many jobs that imply some kind of biomechanical overload. And another aspect is that the so-called informal work is largely spread all over the world, especially in some parts of the world, and the informal work often includes biomechanical overload. So we cannot neglect those data when thinking at a global approach to the question of biomechanical overload and prevention of disease. Coming to Europe, we know better. The data from Europe is well known that physical risk, including standing, posture, manual handling, repetitive tasks, are the most spread risk involving a great part of the European workforce, as well as when considering official occupational disease, musculoskeletal disorder represents almost 2/3 of all recognized occupational disease in Europe. So we need some strategy. And within this strategy, risk assessment is one of the pillars of the strategy. Maybe the most important, and risk assessment should consider with regard to biomechanical overload, many risk factors in an integrated way, where organizational factors represent a real important problem in defining the overall exposure. So risk assessment could be very easy, also informal, or could be very detailed, but it should always be aimed to identify the problems, the risk factors, for the consequent preventive action. So the management of those kind of risks should be complete at 360 degrees, coming from the risk assessment up to the reintroduction of workers who suffer of such disease into the workforce. So, to this aim, we need also simple tools and the training outside the world of ergonomics. So thinking to all those things, and when preparing this key lecture, I was wondering to deal with many items. Could be the hedging our force, could be the Industry 4.0, or the exoskeletons, but we prefer to focus our attention to two aspects that are really important, almost from an applicative point of view. That are simplification and multiple task analysis. Regarding simplification, we are trying to follow the indication by international agencies like WHO, ILO, or ISO, and that suggest to use simple tools and to use more sophisticated tools as a second or a third choice, but also suggest to consider in an holistic approach all the risk factors that are connected to a certain working condition, and they stress the concept that a participatory approach involving the workers is essentially, especially when using simple tools. So I refer to a proposal, a document, a technical report prepared by ISO on the aspects of biomechanical overload that follows this approach, identifying conditions where some assessment should be done, proposing a quick assessment procedure for each of the conditions that could determine a biomechanical overload, and to use more detailed tool, the one that we discuss in our conference, only as a third choice. And so the identification of problem in this proposal is very simple. For instance, for lifting, the question is, are you lifting a load of more than 3 kilograms or not? If yes, you have to consider the problem. It's not a risk. You have to consider the problem. And if you consider the problem, you have the chance to use a quick assessment procedure. And the quick assessment procedure in this proposal produce 3 possible outputs. With few demands, or few questions, you can assess by interviewing the workers if the condition is fully acceptable. No further action. Or on the other hand, if the condition is surely critical. Or there are conditions that are not critical, not acceptable, and you have to detail more the analysis. Like an example, those are the few questions to assess if a condition in a repetitive task is acceptable or fully acceptable or fully critical. And the recommendation is that when a condition is fully critical, approach, we imagine a tool for the quick check not only of biomechanical overload conditions, but also of other risks for the health that we call ergo check, that gives not a real risk assessment, but a profile of the condition with simple results that are not complete, but are good to know which are the important suggestions for solution. I want to remember the ergonomic checkpoint produced by IAA in collaboration with HILA. But I want to stress more this concept because there are forthcoming experience regarding the bank of solutions accessible by the web. I want to remember just one from the Department of Industrial Engineering of the University of Bologna that has prepared a bank of solutions. They are generally technical solutions for different working sectors, and they are accessible by the web. And so the idea of the bank of solutions is an idea that should be highly improved by public authorities. And so we can go to the second aspect, that multitask analysis. In fact, in our experience, more and more, when we look at the workplace, we have the problem that many tasks are performed by the same worker in the same period of time. But the same period of time, sometimes is a shift, but sometimes is a week, sometimes is a month, sometimes is a year, like in agriculture. And so we have to face the problem of analyzing those contexts. We gave our contribution with manuals, with papers, both regarding lifting, where we defined a lot of lifting conditions, composite, variable, sequential lifting condition, and also the procedure to analyze those conditions that are now reported in a draft version of the updated ISO standard 11228 part 1. And about this, I want to recall your attention that tonight later there will be a special session devoted to the extension of the revised anhydrous lifting equation on this peculiar approach. But more and more, the multitask approach is needed when looking at repetitive tasks, because again, in manufacturing, maybe that the most of cases the rotating tasks are during a day, a shift. But in other contexts, the rotation has a floor on a week or a month or also a yearly basis. And this happens especially in some neglected sectors. And it's very difficult to explain how to face this problem, but I think there are proposals, and there are proposals to face this problem using a more detailed organizational analysis, not a mechanical or biomechanical analysis. We have proposal, and tomorrow at noon, more or less, there will be a session illustrating how to perform analysis in such a context. But substantially, especially for the most difficult sectors, we are thinking to propose models for collecting data and managing data, to have a sort of data bank of pre-evaluated tasks, pre-evaluated by experts, that can be used by practitioners that should only apply an organizational analysis of their own context, combining the data coming from the data bank. Obviously, to build such a data bank is rather difficult, and we need some help, some collaboration all around the world, because the tasks to be analyzed are more and more. We start with some experience, and we will follow on others' experience soon. And we are not the only one that deal with the question of multitask analysis. Several authors have dealt with it, but I want to remember our friend Arun Garg recently passed away, and who, with his team, recently developed the cumulative lifting index proposal and the cumulative strain index proposal that go in that sense. However, a lot of that work should still be done, especially for what concerns pushing and pulling or awkward posture in the near future. That's a problem of the experts. So coming to conclusions, for a proper risk management of this risk, biomechanical overload and the risk of musculoskeletal disorder, a proper attention should be adjusted to all influencing factors, mechanical, organizational, psychosocial, also individual. But organizational factors play a very relevant role, and so attention most of all to the organizational factors, keeping in mind that our final goal is substantially the risk reduction, and this risk reduction should be achieved taking into account the different needs, the different cultures, the different financial properties in different parts of the world. And finally, we know that biomechanical overload is widespread all over the world and produces a lot of adverse health effects. And we know also that physical ergonomics has traditionally been involved or interested mostly in manufacturing sector, in office work sectors, and in some way other sectors have been partially neglected, also because it's more difficult to have analysis of those sectors, but to have solution. I think it's not a new idea, but that as a world ergonomics movement, it's time to look more in detail to those sectors and those parts of the world, proposing simple tools, training for those who are involved, and also sustainable strategies for the prevention. And our final slogan, as Ricardo yesterday remembered, ergonomics is a democratic discipline. And democratic means this is also for the people. So ergonomics for all is our final slogan. Thank you very much.
Thank you, Professor Occhipinti. I invite you to remain on the podium. And democratically speaking, Enrico, you have to debate with him, okay? So remember, only time, okay? Thank you.
Thank you. Thank you, Enrico, for this interesting presentation. As all you know, the last 20 years, a lot of simple tools and simple methods have been published to obtain simple procedures to do risk assessment regarding to biomechanical overload. But you have presented one relative new approach published by ISO and the related software tool for apply it. And I will ask you what are the values of this new approach compared with the previous tools and methods?
How to say, technically, maybe nothing. The added value of this tool, especially for what concerns biomechanical overload or conditional biomechanical overload, that means lifting, lowering, carrying, pushing and pulling, awkward posture, and repetitive tasks, is that they are derived directly from existing ISO standard. And so they are a translation in practice and in simple tools of the content and the criteria of the ISO standard, of the existing ISO standard. Mm-hmm. So when you apply the quick assessment procedure, for instance, and you have a result that says that's green, that's acceptable, you are in conformity of what an ISO standard says. So the added value is only that. In fact, when we proposed the tool, it was not exactly like this now, and we adapted step by step to what the ISO standard prescribe or the technical report prescribe.
Mm-hmm. Okay, and I know that this document and this tool have been published 2 or 3 years ago. So in this period, what is the practical experience of these simple tools? Do you have some results? Have you do some approach to one of these specific sectors?
Yes, we experienced the tool from 2011 in a progressive way, and this was experienced especially in craftwork and in small enterprises, because it's useful. Sometimes it's the only tool that they could use. And as I said in the short courses yesterday, this is better than nothing. And that produces results, how to say, in an orderly way to find priorities of intervention. And this has been used not only by individual small enterprises, but by a consortium of enterprises, an association of small enterprises in Italy. And on the other hand, it was used also by big enterprises. Obviously, not for a complete procedure of a risk assessment due by the law, but for a first screening of all their workstation, just to know what I have to analyze in more detail, or if I have some critical condition, what I have to solve immediately. And this is an experience not only in Italy, maybe in Poland, maybe in France. There are experiences of big companies using as a preliminary systematic tool of analysis of the workplaces.
I would like to complement your comments with my experience related to a lot of countries in Latin America. We have taught a lot of courses on this procedure and this kind of tool last years, and now from a practical point of view, the consultants has taken this tool as the first screening in all companies, especially in big and industrial companies there. So it's the first step to start to do something, to start the first step in the managing risk. So it's just like that my comment to complement that is not only the experience in Europe, but also in countries in Latin America, this kind of procedure is being applied a lot in a lot of companies. And regarding the multitask approach, we are aware that it's very complex. So we have to do more effort how to approach, how to do something to manage the risk in this kind of sectors, in this kind of workplaces, where variability is the main work condition. And you have presented that some models, some computational models has been proposed for manual material handling and for repetitive movements. But it has been done some practical experience, not only theoretical or mathematical models.
Yes, of course. Yes, there are practical experience, and we have also some database of pre-evaluated tasks, a complete list, or quite complete list of pre-evaluated tasks in some sectors like retail, especially food, like cleaning, and like preparation of food in communities. And we are progressing, but collaboration are needed, for instance, in the sector of agriculture or in the sector of construction. And to this purpose, I want to remember that an isotechnical report on biomechanical overload in agriculture is on the way, and we are organizing with this conference a group of experts in agriculture and in biomechanical overload, just to give material to the idea of this technical report, and to implement this data bank of pre-evaluated tasks in agriculture all over the world. We know better the Mediterranean cultures. We have a lot of cultures around the world to be evaluated. The first evaluation was on wine, of course.
Good idea.
Okay, your time is finished.
We finished.
Okay, thank you very much, Professor Occhipinti and Alvarez Casado Enrico.
Thank you.
I said that okay. And now, on behalf of the organizing committee,